Welcome to this educational video from Bowen Insurance Group, covering the basics of Medicare. Every year, millions of Americans have their own experiences with this program. And whether you have been using benefits for decades or are brand new to the whole process, we are here to help navigate the options for coverage in a constantly shifting environment. In this video, we will define Medicare, list the various parts of Medicare, as well as the functions for each. Underline eligibility and enrollment periods, tell the difference between original Medicare and Medicare Advantage, and explain how we help both new and current clients find the plan that's right for them. Let's start at the beginning. What is Medicare? Medicare is a federal insurance program, primarily for individuals that are age 65 and older, though it also covers younger individuals that have disabilities or special health conditions. To be eligible for Medicare, individuals must meet certain criteria, such as being 65 or older, or under 65 with a qualifying disability or condition. When someone ages into Medicare, they will have certain enrollment periods depending on their situation. The initial enrollment period is the first opportunity for most people to sign up for Medicare Parts A and B. It's a 7-month window that begins 3 months prior to the individual's 65th birthday, the month they turn 65, and 3 months after the month they've turned 65. If you sign up before the month of your birthday, coverage begins the first day of your birth month. If you sign up during or after your birth month, coverage may be delayed until the following month. If someone misses their initial enrollment period and does not qualify for a special enrollment period, they can enroll during the general enrollment period, which runs every year from January 1st to March 31st. If someone qualifies due to a special circumstance outside of the typical enrollment periods, like losing employer-based coverage, they move out of the plan's service area, lose Medicaid eligibility, experience changes with Medicare Advantage or Part D, or qualify for a low-income subsidy or extra help. If one of these or several other factors apply, then they may be eligible for a special enrollment period. Medicare consists of 4 parts, each providing different types of coverage. Here's a breakdown of each part. Part A covers hospital insurance, including inpatient hospital stays, skilled nursing facility care, and some home health care. Part B is for medical insurance. Outpatient care, doctor's visits, and some preventative services fall under this part. Part C refers to Medicare Advantage. This is an alternative to original Medicare Parts A and B. It includes coverage for both hospital and medical coverage, often with extra benefits, like vision, dental, and prescription drug coverage. Part D is specifically for prescription drug coverage. It helps cover the costs of prescription medications. There are certain penalties set in place for those who do not sign up for Medicare when they are first eligible and do not qualify for a special enrollment period. If you don't sign up for Part B when you're first eligible, your monthly premium increases by 10% for each full 12-month period you were late. This penalty has dire consequences, as it sticks with you for life, meaning you pay for it for as long as you have Part B. If you don't enroll in Part D when you're eligible, you will pay a penalty once you do enroll. They calculate this by taking 1% of the national drug plan average, times the number of months you were without coverage. This penalty is for life. Avoid these Medicare penalties by signing up for Medicare when you're first eligible, typically during your initial enrollment period. If you have employer coverage, make sure it qualifies as credible coverage and sign up during a special enrollment period when it ends. And consider enrolling in Medicare Part D, even if you don't take prescriptions, to avoid future penalties. One of the most important decisions in this process is whether to enroll in original Medicare or a Medicare Advantage plan. Both have pros and cons, and understanding the difference is key. With original Medicare, clients can see any doctor or specialist who accepts Medicare, but they may need to buy additional coverage, like a Medigap policy, to help cover out-of-pocket costs. On the other hand, Medicare Advantage plans are offered by private insurance companies that were approved by Medicare. These plans combine Parts A, B, and D coverage and may offer additional benefits like dental, vision, and hearing coverage. However, these plans come with network restrictions, so it's important to make sure preferred doctors are included. As insurance agents, we use a wide range of tools and resources, from enrollment platforms to comprehensive plan comparison tools. We also receive ongoing training and proudly enforce ethical guidelines and compliance regulations. That means that when we're speaking with clients, we are transparent about the plans that we represent, avoid pressure tactics, and ensure that the options are fully understood before making a decision. Here are some key factors that we look for during this process. It's important to assess your healthcare needs. Do you make frequent doctor visits? What kind of medical equipment do you use? Do you take prescription medications regularly? You must consider your budget and how much you can spend on a plan. For the plan to be effective, your doctors, specialists, facilities, and medications must be covered. Some Medicare Advantage plans offer extra support, like dental, vision care, hearing aids, and gym memberships. This can be a deciding factor for some clients. As you can see, there is a lot of information, but you don't have to do this alone. If you have questions and would like to speak with one of our agents, please don't hesitate to reach out. Whether you're enrolling for the first time or reviewing your current plan to make sure it still meets your needs, Bowen Insurance Group is here to help every step of the way.